Welcome back. For one KU medical student, a near-death health complication has now redefined the work she's doing in the world, and it's not only in school.
Yeah, it's also far beyond the walls of the classroom. Here is Fox 4's Malik Jackson with C's remarkable journey from patient to changemaker.
And it was kind of just like horrifying to know what will happen to me if I don't get the treatment I need.
Caitlin C. is rounding the corner of year 2 here at the University of Kansas School of Medicine, something that 14 months ago didn't seem possible.
My immune system thinks that my platelets are germs, so it destroys them, and that keeps me from being able to clot my blood when I get injured. So just a little bump or scrape for someone else is not a big deal, but for me it could be a big problem.
C received this devastating diagnosis just over 4 years ago, the immune disorder ITP, a condition that could have unraveled everything she had worked for her whole life. C required a blood transfusion to save her life. To stay stable, her doctors needed to give her a long-term solution. That's when they prescribed her a medicine to do just that, called Promacta.
But when I got to the pharmacy, we found out that medication cost, they told me $8,000, but it was actually more like $10,000 a month.
For each refill?
Each refill, yeah, every month. And this is a maintenance medicine. So $10,000 a month, that adds up pretty quickly.
Well, that's $120,000 a year.
Basically, on top of my tuition, as a medical student, I already have loans.
So she went to her insurance company to see if they would cover the medication. While she waited for Blue Cross and Blue Shield of Kansas City to make a decision, she was put on a stopgap medication that produced terrible side effects that forced her to pull back from all medical school activities.
I seriously considered dropping out of medical school. I spend so much time, so much effort, so much money trying to learn about how to treat diseases, and then a single word from an insurance company can keep any of my work from mattering. I was like, what's the point?
The denial happened because of a misunderstanding about her insurance coverage. She and her providers thought she had one plan, but the insurance company said she was actually enrolled in another with a very similar name, but different coverage. Proof of the complexity that insurance can present. This, a crushing reality that left her with few options. That's when her classmates and neighbors, some of you at home, stepped up.
Hey, can we start a GoFundMe? And honestly, I'm like, dude, I don't have anything to lose at this point. Like Fox 4KC amplified my story.
She says she refuses to be silent.
And my community came together.
That GoFundMe raised more than $20,000 to cover the first 2 months of her medication. She got on her father's insurance, which now covers the entire cost of this life-saving drug. The publicity around her story led to an investigation by the Kansas Department of Insurance into Blue Cross and Blue Shield of Kansas City. That state agency determined the insurer did nothing wrong.
If everything they did was legal, the laws need to change.
C, discouraged but not broken, got back on her feet, returned to med school, and started to try and change the law. She and a group of advocates wrote a petition that got over 600 signatures for a bill to institute prior authorization reform in the state of Kansas. The bill last session proved unsuccessful, but C and others involved didn't let that stop them. Currently, Senate Bill 330 that would usher in this reform currently sits in committee. The deadline for the bill to make it out before it dies again is tomorrow, February 19th. C is optimistic that it will in fact go to the floor.
Some of our anesthesia came from pharmacies that sold it to us on discount.
Her work doesn't stop there. C is also now the Director of Funding and Community Outreach for the Socially Responsible Surgery Clinic that partners with Care Beyond the Boulevard. The clinic provides free health care for those who are underinsured or don't have insurance at all. The Safety Net Clinic operates 9 to 12 pop-up clinics every week. Caitlin C. and other med students who work in this part of the clinic perform any surgery that can be done under local anesthesia. Cheryl Ward says they are blessed that these students spend their free time volunteering here.
As a volunteer coordinator, that's one of my proudest moments, is when I see these young students.
This experience showed me that silence is not a luxury that I had. It's like, basically, how people would say, if you're not at the table, you're on the menu. So you gotta speak up sometimes.
So we're not on the menu.
Yeah.
We don't want to be ate, we want to eat.
Yes, indeed.
In Kansas City, I'm Malik Jackson, Fox 4, working for you.